Mr. A is a 56-year-old high-profile businessman who came to New Orleans for a conference and has a history of panic attacks, which he usually treats as Xanax. He comes into the ER because he thinks he's having a panic attack and wants a refill for his Xanax, which he left at home. While he's in the waiting room, he's loud, obnoxious, and contentious, but the nurse also notices he's clutching his chest. Because of this, the nurse suspects a possible MI and pushes him to the front of the triage list.
Violence, service.
We are now going to explore 3 different ways the situation can play out.
Sir, please tell me what's brought you in here today.
Like I told 5 people already. I'm having a panic attack. It happens all the time. My doctor back home just gives me Xanax without asking me any questions. I have a presentation to give at the convention center in 45 minutes, so just give me some Xanax. I'm on my way.
Sir, I'm not going to be able to let you go until I ask you some questions, maybe run some additional tests.
I don't have time for that. Just give me some Xanax.
Okay, yeah, it looks like everything's in order. I think you're definitely having a panic attack. Here's a prescription for Xanax. Actually, here, take another one, and don't ever come back here. Here, take my old prescription pad.
I'm taking charge of my health care.
In this scenario, the doctor was too timid, which allowed the patient to take advantage. And in this case, the physician was not able to act in the best interest of his patient. Let's take a look at another scenario.
All right, sir, what's brought you in here today?
Like I told 6 people already. I'm here on business. I'm having a panic attack. I have to give a presentation at the Holiday Inn in 45 minutes. Just give me my Xanax, and I'll be on my way.
Sir, I am not going to be able to let you go until I ask you some questions, maybe run some tests, find out if there's something else going on.
I don't have time for that. Just give me my Xanax.
Now you listen to me! I'm the doctor, and you're in my house! Out there, you might be a high-powered businessman, but in here, I call the shots. If I say we're going to run some tests, we are going to run some mother-flipping tests! Considering a meeting canceled.
In this scenario, the physician lost his temper, which exacerbated the patient's condition. In every situation, the patient's well-being has to be at the forefront of the physician's mind. Let's look at one more scenario.
All right, sir. Tell me a little bit about what's brought you in here today.
Like I told 7 people already. I'm a high-profile businessman. I'm having a panic attack. I'm giving a presentation at the International House of Pancakes. Give me some Xanax and I'll be on my way.
Sir, I'm not going to be able to let you go until we ask you some questions, maybe do some tests, just see if there's something else going on.
I don't have time for that! Just give me some Xanax!
Sir, I understand you're very frustrated, and you're in a hurry. Honestly, I can see you're a very intelligent man, and please understand, I would never suggest running additional tests unless I thought it was absolutely necessary. While many of your symptoms suggest a panic attack, which, as you point out, would certainly be helped by Xanax, some of your other symptoms, like your acute chest pain, indicate something like a heart attack. If we don't identify and treat this immediately, there could be far more severe ramifications than simply a missed meeting.
Okay, this last scenario is an example of a positive way to deal with the situation. The physician established his authority without being overbearing or condescending. He doesn't acquiesce to the patient's unreasonable demands. And by understanding his audience, like he's a high-powered businessman, he's able to act in the patient's best interest. So at the end of the the day, you should always remember that a doctor's job is to give you what you need, not what you want. So, words to live by, everyone.